So, hi friends, I'm Dr. Anshul Bansal again joining you on this Unacademy platform. As you all know, in today's session, we will discuss entire orthopedics and images. बहुत जल्दी जल्दी फटाफट सेशन होगा रैपिड रिवीजन एंड कल सबका एग्जाम है. ऑल द बेस्ट टू एवरीबडी. अच्छे से सोना, सुबह कोई पढ़ाई वढ़ाई करने की कोई ज़रूरत नहीं है. अच्छे से सोना, take breakfast and go to examinations with positive mind ki only few hours left, then you will be free, you can do party, you can go for a trip, everything. Okay, so अब पढ़ाई हो चुकी है. जस्ट एक डेढ़ घंटे में ऑर्थोपेडिक्स रिवाइज करते हैं. पूरी ऑर्थोपेडिक्स कवर हो जाएगी, बहुत मजे आएंगे, है ना. एंड देन यू sleep and go for the examination. So all the very best to everybody. Okay, so currently I'm working as an orthopedic house surgeon in SMS Hospital Jaipur, and I've cracked the same NEET PG examination last year, that is in 2020. So I can correlate with your feelings and आपका दुख समझ सकता हूँ मैं, है ना. And I can understand कि yes, it's very tough, but yes, you'll currently at this time tomorrow you will be so happy and you will be partying, I'm pretty sure. So yes, all the best to everybody. So let's start today's session. And before starting it, jaldi se I will just tell you about a paid subscription plans available on Unacademy for the NEET PG. The first one is your plus subscription plan, in which you will get everything that you need for the NEET PG preparation. That is, you will get access to all our live and recorded classes, all our QBanks. You can participate in a live tests and quizzes, all of which formulated by India's topmost educators for NEET PG. And also we'll allow you to log in with the same account on different devices, so that you can study on any device of your choice at any time. And also we'll be providing you with the printed notes for the subscribers who will subscribe for 12 months or more. And you can use this code to get extra 10% off while subscribing. And second one is the iconic subscription, and it is the best one, best not only on an academy but also on any digital platform across India. In this you will get extra may, apart from the things that I've told you earlier, extra may you will get the prep ladder and all of the prep ladder, including its QBanks, the video lectures, the rapid revision courses, the test, the grand test, everything. And on an academy you will get extra may well structured live batch wise classes. Okay, and we have formulated a batches and classes in such a way so as to build your basic concepts about any topic or the subject first, and then going its in depth, and also correlating the same topic with other subjects also, so as to repeatedly revise that thing and also to make you understand the concepts better. And after every test, the iconic subscribers will get their individual test assessment sheet, and you can analyze yourself, and also you can find out key yes, in this topic or in this subject I have to work harder, so that you can plan your studies accordingly. And you can use this code while subscribing for this subscription to get extra 10% off. स्पेशल स्पेशल क्यों होती है? सबसे पहले तो they'll every time give you some extra edge over the others. And also in this COVID times also, classroom like feel आपको आएगी when you attend this special class. You can interact with your educators and clear your doubts there and there only. And you can also watch it anywhere anytime just by you opening your Unacademy mobile application and then subscribing it using this code, and both of which are absolutely free. Okay, and keeping in mind the various sets of students who are targeting different examinations, like some are targeting FMG or the next year's NEET PG or the next examination, so we have started dedicated batches to our following courses, and you can use this code while subscribing for these courses to get extra 10% off. And we have already started our FMG and the next 2022 batch from the 8th September only. Okay, and 1 month, last 1 month NEET PG package we had formed, and we have got very good results of it. Okay, so I hope you all liked it. And also for the subscribers who will be subscribing for 12 months, we are running a special time period offer in which you will get 2 months of that subscription absolutely free. And for our MBBS students, we have started a 4-year subscription package in which we are giving a limited time period offer in which you will get the iconic subscription for just 75,000 for the entire 4 years, and also the plus subscription सिर्फ 60,000 रुपए में. So you can go for these subscription packages, and you can use this code while subscribing to get extra 10% off. And I would like you to go for the subscription package with longer duration of months, because firstly, as you can see, the cost per month decreases significantly if you increase the duration of your course. And secondly, keeping in mind the next pattern, you have to look forward for a post graduation examination, or prepare for it from the starting of your MBBS only. And start, सबसे important है एक source, एक reliable trusted source is very important, because bar bar if you will change the source, you will get confused. So Unacademy is the best source. We provide you everything necessary for the NEET PG preparation. So लंबा ड्यूरेशन का कोर्स लो, इकोनॉमिकली भी you will get benefit, and also for your study point of view also it will be more beneficial for you. And you can use this code while subscribing for any of our plans to get extra 10% off. Now let's start today's session jaldi se. And before starting, let's crack NEET PG with an academy. Okay, ये बोलना जरूरी है. Now first of all, this is figure of 8 bandage, also called as the clavicle brace. तो obviously ये किस में होगा? It is used for fracture clavicle, and fracture clavicle का most common site is middle 1/3, followed by the junction of the middle 1/3 and the proximal 1/3. सर्जरी एंड ऑल की जनरली जरूरत नहीं पड़ती है. माल यूनियन हो भी जाता है तो इट इज ओनली ऑफ द कॉस्मेटिक वैल्यू. ओके, फ्रैक्चर क्लेविकल. Now this is your part of the, and fracture clavicle में just remember name of one classification which is called as Allman classification, used for this fracture of clavicle based on the site of the fracture, the Allman classification. Now this is the proximal humerus. यहाँ पे the head and GT एंड LT के बीच में there is a line called as the anatomical neck. A पहले आता है इसलिए A ऊपर भी है. उसके नीचे the line which separates the GT and the shaft is called the surgical neck of the humerus. यहाँ पे एक तो axillary nerve relation में होती है इसके, एंड सेकेंडली फ्रैक्चर साइट भी यहाँ पर ज्यादा होता है. ये काम की बात है. Okay, very important about the anatomical neck and the surgical neck of the humerus. नाउ फ्रैक्चर प्रॉक्सिमल ह्यूमरस जनरली एल्डरली पॉपुलेशन में होता है, एंड किसी भी फ्रैक्चर में अनडिस्प्लेस्ड है तो कंजर्वेटिव, डिस्प्लेस्ड है तो यू हैव टू गो फॉर द सर्जिकल करेक्शन. प्रॉक्सिमल ह्यूमरस में एक क्लासिफिकेशन दैट यू नीड to remember is your NEER classification. 1 part, 2 part, 3 part, 4 part fractures. NEER classification is very important for fracture of proximal humerus. Okay, now this type of cast is used for fracture of greater tuberosity of the humerus. Okay, and there is pull of supraspinatus muscle, that's why they are frequently displaced. And so याद रखना, supraspinatus or the rotator cuff muscles are attached on the greater tuberosity. Okay, so rotator cuff muscles are important, and इसमें there are 4 muscles. First is your supraspinatus, second is your infraspinatus, and one more S is that is subscapularis, and fourth is the teres minor. Okay, remember this. Now the types of cast used for the fracture of humerus. Shaft of humerus prototype fracture होता है. Okay, and because it can occur in any form, and there is more frequently radial nerve injury associated with this. If it is, and there is increased vascular supply and increased muscles, that's why there are high chances of union. So conservative management is preferred. And importantly, जो conservative management है इसमें first you have the U slab from the nape of the neck to the lateral side, then to the elbow to the medial side, and second one is the hanging cast, which is used in the distal one third fracture. Okay, this is your hanging cast. Okay, this is your U slab, and this is your cast brace with the strapped with the chest. Okay, in बच्चों में, in children. Okay, now distal one third and middle one third and distal one third के junction पे the fracture is mostly associated or most commonly associated with the radial nerve injury leading to the wrist drop. That, and this fracture is very important नाम की वजह से, and this fracture is called as the Holstein Lewis fracture. Okay, now the different parts of the plane, ये important है, basic चीज है. What is sagittal plane? जो body को divide करे into right or the left. The frontal or the coronal plane body को divide करता है into anterior and posterior, and the transverse horizontal or the axial plane into superior and the inferior parts. Okay, now shoulder में the flexion and extension occurs in the sagittal plane, and the abduction and adduction it occurs in the coronal or the frontal plane. And इसमें the abduction of the shoulder joint is very important. Okay, first 15 degrees is done by the supraspinatus muscle. 15 to 90 degrees is done by the deltoid muscle, and उसमें भी its middle fibers, and the overhead abduction called 90 degrees से ज़्यादा called as the overhead abduction. It is done by the trapezius and the serratus anterior. Okay, and mid abduction में if there is pain, it is called as the painful arc syndrome. Rotator cuff mainly supraspinatus, and impingement syndrome due to impingement of the subacromial bursitis. Okay, ये आपको ध्यान में रखना है, very important. Okay, now shoulder dislocation. Most common joint to get dislocated in the body is the shoulder dislocation, is the shoulder, and उसमें भी anterior में भी बहुत सारे तरह के होते हैं, जिसमें से most common is the subcoracoid. And कोई भी dislocation हो body में, the treatment of choice is your close reduction under GA followed by its maintenance, and if वो नहीं होता then open reduction and internal fixation. Okay, subcoracoid, subglenoid, subclavicular, intrathoracic, बहुत सारे तरह के होते हैं शोल्डर डिसलोकेशन. अब शोल्डर डिसलोकेशन में जो मैनूवर्स होते हैं उनके नाम बहुत इंपॉर्टेंट है. Okay, first of all is the Kocher's maneuver, most important and most commonly used. T1 यानी सबसे पहले sustained traction followed by external rotation, then adduction, then internal rotation. This is your Kocher's maneuver. And जिसमें axilla में foot use करते हैं, that is called as the Hippocrates maneuver. And if fracture GT is associated with this, then you go for the Hippocrates maneuver. Okay, now anterior shoulder dislocation में you have two tests. First is your Dugas test, जहाँ पे आप opposite shoulder पे touch नहीं कर पाओगे अगर आपका dislocated है shoulder तो. And Hamilton ruler test, that this contour, the round contour will be lost, due to which you can place a ruler at the lateral edge of your arm. This is your Hamilton ruler test. Okay, now एक और बात याद रखना, in anterior dislocation you have to, अगर chronic cases है then you can have the Banker's lesion, which is at the anterior inferior surface of the glenoid labrum, जो एक chip of bony chip के साथ, bony chip avulsion के साथ भी associated हो सकता है, called as bony Banker's lesion. And second is your Hill-Sachs lesion, that is a depression on the humerus head in the posterior lateral aspect of the humerus head. It is your Hill Sachs lesion, very important. Now we come to the elbow. Elbow mein, you know, when you will flex the elbow, you will feel three important bony prominences: the olecranon, medial, and the lateral epicondyle or the condyle, and they form an isosceles triangle. और जब आप extension में they come in a straight line. Now there is one fourth bony prominence, and this fourth bony prominence is called as the radial head. ये याद रखना है. Important is कि supracondylar humerus fracture में it will be maintained, and in lateral condyle or medial condyle fractures में it will not be maintained, and in posterior dislocation or the dislocation of the elbow it can be reversed. Okay, so ये याद रखना है. This is your carrying angle between the horizontal long axis of humerus and ulna. Okay, normally it is 11 degrees in males and 14 degrees in females. अगर laterally यानी valgus L से L, then it will be increased, in varus or medial deformity it will be decreased. Okay, very important is a carrying angle. Now pulled elbow. So pulled elbow generally बच्चों में होता है, also called as the nursemaids elbow. Okay, in due to the dislocation of the radial head in annular ligament or dislocation of the annular ligament itself. Okay, and it is a lex ligament in children, and radial head is also cartilaginous. So x-ray mein you will not see it, and the forearm will be in the pronation position. So isko ठीक कैसे करते हैं? First of all, supine the forearm, then giving traction you have to flex the elbow, feeling the bony points, and you can feel a click sound when it is relocated. It is called as pulled elbow. Very important. Now this is pointing index or the Ochsner's clefts in the median nerve palsy. Okay, very importantly associated with the supracondylar humerus fracture. Supracondylar humerus fracture के साथ median nerve and radial nerve यानी wrist drop दोनों ही associated होते हैं, but median nerve is more commonly associated. Okay, median nerve is more commonly associated. Very important. And the most common complication of supracondylar fracture of humerus is your cubitus varus deformity, also called as the gunstock deformity, which is a malunited supracondylar fracture humerus यानी late complication है. And most common early complication is your injury to the median nerve. ओके, वेरी इंपॉर्टेंट. एंड मोस्टली फिजियोथेरेपी से ठीक हो सकता है, या कॉस्मेटिक प्रॉब्लम ही होती है दिस गन स्टॉक डिफॉर्मिटी. बट इफ इट इज वेरी सिवियर देन यू हैव टू गो फॉर एन ऑस्टियोटमी, एंड इस ऑस्टियोटमी का नाम याद रखना है, कॉल्ड एज द फ्रेंच ऑस्टियोटमी. मोस्टली सुप्राकॉन्डाइलर फ्रैक्चर ऑफ बच्चे occurs in of humerus occurs in children. Okay, and is supracondylar humerus fracture के साथ you have very important classification called as the Gartland classification based on its displacement. You have to remember this. That is your Gartland classification, and treatment of choice is close reduction and maintaining it with the K wires. Now most common vessel injured in this supracondylar fracture of humerus is your brachial artery, and उसमें भी कौन सी, the anterior interosseous branch, which supply to the flexor compartment of the forearm. And okay, flexor compartment of the forearm, and due to this there can be compartment syndrome also. There can be Volkmann ischemia leading to the necrosis, and the long term में the fibrotic changes of the flexor tendons, leading to this type of contraction called as Volkmann ischemic contracture. and इसमें you have the Volkmann ischemic sign, जिसमें अगर आपका wrist flex है तो वो आपके the interphalangeal joints will be extended, and if they are flexed then only you can extend the wrist. This is Volkmann ischemic contracture. Okay, remember. And here for this you have this Volkmann ischemic splint, or also called as the turnbuckle splint. Remember, photo देख लो अच्छे से. And very important, the differentiation between the Monteggia and the Galeazzi. Okay, so आपको याद रखना है G से Galeazzi, and RD means radius and distal 1/3 radius with dislocation of the radio-ulnar joint, and Monteggia is your MUP, that is proximal 1/3 ulna fracture with dislocation of the radius head. Bardo type सिस्टम चलता है इसमें, एंड बाडो टाइप 1 इज योर एक्सटेंशन मोस्ट कॉमन टाइप, जिसमें एंटीरियर डिसलोकेशन होता है. और सुप्राकॉन्डाइलर ह्यूमरस फ्रैक्चर में भी एंटीरियर टाइप इज मोस्ट कॉमन, बट extension type is most common, but it is posterior direction में. And second is your flexion type or the reverse Monteggia dislocation, जिसमें posteriorly you have the dislocation of the head as well as the fractured segment. Okay, so this is your Monteggia versus Galeazzi, वेरी इंपॉर्टेंट. एंड कोलीज कैसे याद रखना है, सी के बाद डी आता है, यानी कोलीज फ्रैक्चर कैसे होगा. फर्स्टली वेरी इंपॉर्टेंट डॉर्सल टिल्ट, डी फॉर डिनर फोक डिफॉर्मिटी, एल्डरली के अंदर होगा. ओके, एंड डॉर्सली एंकुलेटेड होगा, very important. This is your dinner folk deformity. Cole's cast में first you shaking hand manner, सबसे पहले shaking hand for the reduction, then disengaging both the segment, then palmar flexion followed by the ulnar deviation, This is your Cole's cast, very important. Shaking hand position में close reduction, and it is a picture of late complication of Cole's fracture called as the Sudeck's osteodystrophy. Okay, skin condition होती है Sudeck's osteodystrophy. Okay, and most common complication of Cole's fracture is your wrist stiffness or the stiffness of the joint. Okay, very important. Now Cole's fracture तब होता है when you fall on an outstretched or extended wrist. If you fall on an flexed wrist, it is called इसमें जो fracture होगा that is Smith fracture, which is just opposite of the Cole's. and इसमें क्या होगा, there will be ventral or anterior tilt of the distal fragment. This is Smith. बाकी सब कुछ सेम होगा, दोनों ही डिस्टल एंड रेडियस कॉर्टिको कैंसिलस जंक्शन के एक्स्ट्रा आर्टिकुलर फ्रैक्चर्स होते हैं, और इंट्रा आर्टिकुलर फ्रैक्चर्स एसोसिएटेड विथ carpal displacement also, then they are called as the Barton fractures. Okay, they are called as the Barton fracture. And radial styloid, not this pura radial styloid which is intra-articular like this is called as Schoffer's fracture or the Hutchinson or the backfire fracture, very important. Now what is tennis elbow? Tennis elbow is lateral epicondylitis. तो इसमें क्या होता है, मोस्ट कॉमनली अटैचमेंट होता है उसका लेटरल एपिकॉन्डाइल पे, किसका, एक्सटेंसर टेंडेंस ऑफ द फोरआर्म, एंड उनमें भी क्या उनका ओरिजिन होता है. एंड मोस्ट कॉमन एसोसिएटेड एक्सटेंसर टेंडन इज द एक्सटेंसर कार्पाई रेडियालिस ब्रेविस, very important, remember this. And for this you have a tennis elbow splint or a tennis elbow support, which is like this. around in the entire circumference. And medial epicondylitis mein you have the golfer's elbow. Okay, you have the golfer's elbow medial epicondylitis mein. Okay, the anatomical snuff box, you very important, fracture scaphoid का पेन यहाँ पर आता है, is the anatomical snuff box. Medially it is formed by the extensor pollicis longus, and laterally it is formed by the abductor pollicis longus plus extensor pollicis brevis. And the content of this are very important: radial artery, superficial branch of the radial nerve, and your cephalic vein. Okay, ये चीज important है, very important for your examination, the anatomical snuff box. Now what is mallet finger? Mallet finger में ऐसा होता है, यानी there will be flexion at the DIP, यानी extend नहीं हो पा रही, so obviously there will be injury in the extensor tendon at the distal phalanx. And its opposite is your jersey finger, where you will not be able to flex, so the injury will be in the flexor tendon, that too in the flexor digitorum profundus. Okay, that too in the flexor digitorum profundus. This is your jersey finger. Okay, now trigger finger क्या होती है? Trigger finger is this, where there is a thickened tunnel at the palmar aspect at near the metacarpophalangeal joint, which सबसे पहले जो नोड्यूल फॉर्म होती है, देन वो थिक होके टनल हो जाती है, सो दे फॉर्म अ ट्रिगर एंड दे लॉक द फिंगर. दिस इज कॉल्ड योर trigger finger. Skyer's thumb or the gamekeeper thumb, forced abduction like this. ऐसे अगर कोई इंजरी हो गई है, तो there will be rupture of the ulnar collateral ligament with avulsion fracture at the metacarpophalangeal joint. This is called as the Skyer's thumb or the gamekeeper's thumb. Okay, what is this? This is your Salter-Harris classification for the epiphyseal injuries. 5 टाइप के अंदर होता है. Okay, like this. And your sixth type is rank type, where there is ring around this perichondrial ring. This is called as Rank's classification, Rank's type, sorry. Now carpal tunnel syndrome में क्या होता है? The median nerve will be compressed under the flexor retinaculum. So carpal tunnel syndrome में median nerve compression की वजह से थम, इंडेक्स एंड द मिडिल फिंगर में नमनेस, टिंगलिंग सेंसेशन, पेन होगा, और उसको एलिसिटेट करने के लिए किसमें? थम, इंडेक्स एंड द मिडिल फिंगर्स. एंड उसको एलिसिटेट करने के लिए यू हैव डिफरेंट टाइप्स ऑफ टेस्ट विच आर Phalanx test like this, the Tinel's test when you will tap on the transverse carpal ligament, and reverse Fennel test. Fennel ऐसा था, reverse Fennel ऐसा हो जाएगा, and the tourniquet or the Gilliel test. Okay, and now decurvant tenosynovitis के लिए you have the Finkel's test, where there is with thumb in the flexion. अगर थम को ऐसे करके थम को फ्लेक्शन में करोगे, तो देयर विल बी अल्नर डिविएशन ऑफ द रिस्ट ड्यू टू इंजरी टू द abductor pollicis brevis. Okay, now these are different types of fingers that you, deformities of the fingers जो आपको याद होनी चाहिए. The Bottomier's deformity में this is your DIP, this is your MIP और the PIP. ओके, पीआईपी भी बोलते हैं, और मिडिल या प्रॉक्सिमल दोनों ही होता है. तो बॉटनियस डिफॉर्मिटी में देयर विल बी flexion at the PIP, and DIP will be in the hyperextension, and in the swan neck the DIP will be, this DIP will be in flexion, and metacarpophalangeal joint जो होगा, it will be in the hyperextension. Okay, now we'll come to the radial nerve. Okay, radial nerve जो होती है, very importantly कहाँ पे branches लेती है? Before entering the shoulder it gives branches to the triceps, that is your long head. It is a radial nerve, याद आते ही आपको नाम आते ही आपको एक चीज याद आनी चाहिए, दैट इज पोस्टीरियर, बिकॉज इट इज ब्रांच ऑफ द पोस्टीरियर कॉर्ड, it runs posteriorly, it supplies to the posterior compartment, that is the extensor compartment. Okay, ये are the extensor muscles. So triceps को देगी, then it will give सबसे पहले again to the triceps, but this time it's medial head, then a cutaneous branch, lateral cutaneous nerve of arm, then नीचे आके it gives to the anconeus, another head of the triceps, and two more cutaneous branches. Then at the elbow it will divide into deep and the superficial branch. The superficial branch will be your cutaneous or the sensory branch, and the deep branch will be a motor branch in the posterior compartment, and it will supply to the extensor tendons. Okay, and also one more important चीज को ये supply करेगा, that is your one more important चीज को the radial nerve supplies, and that is your thenar muscles. That is your thenar muscles, very important, इसको ध्यान में रखना है आपको, है ना. एंड नाउ ट्राइसेप्स को टेस्ट कैसे करेंगे, बाय रेजिस्टेंस एल्बो का एक्सटेंशन, देन यू कैन फील द कंस्ट्रक्शन. ऐसे ही अगेंस्ट द ग्रेविटी इफ यू फ्लेक्स द एल्बो यू कैन फील, दिस इज फॉर द ट्राइसेप्स. And this test against the resistance when you flex the elbow, this is for the brachioradialis. Okay, and the radial nerve mostly gets compressed in your proximal humerus or the shoulder region. So there are different types of palsy name wise which is associated with the radial nerve, and these are your Saturday night palsy, honeymoon palsy, handcuff neuropathy, the crutch paralysis, or the squash palsy. Okay, this is your radial nerve palsy के लिए brace or the splint which is used, and it is a dynamic splint for the wrist drop, because radial nerve palsy में क्या होगा, there is wrist drop, extension नहीं हो पाएगा, तो there will be wrist drop. Okay, this is the very important cutaneous supply of the upper limb, and इसमें भी hand का सबसे important होता है. See, this is your anterior view, this is your posterior view. So first of all, the blue one, the green one, and the pink one. The blue one is your radial by your radial nerve, the green one is by your ulnar nerve. Okay, and sorry, the blue one will be your median nerve. Yes, the blue one will be your median nerve, the green one will be your ulnar nerve, and the pink one will be your radial nerve. Okay, remember this. Now we'll come to the median nerve. Median nerve जो होता है, it supplies to the flexor compartment of the forearm with first two lumbricals, that is your index finger and middle finger वाली lumbricals में. एक्स एंड फ्लेक्सर में किस किस को सप्लाई नहीं करता है, दैट इज वेरी इंपॉर्टेंट. फ्लेक्सर कार्पाई अल्नारिस को एंड मीडियल हाफ ऑफ द फ्लेक्सर डिजिटोरम प्रोफंडस को, इन दोनों को अल्नर नर्व सप्लाई करती है. सबसे इंपॉर्टेंट ये है, ये आपको याद रखना है. एंड अल्नर नर्व सप्लाइज टू द मोर टू lumbricals and the dorsal and the posterior interossei muscles. Okay, very important. This is your median nerve. So median nerve जो भी muscles को supply करती है, they are the supinators are supplied by the radial nerve, and the pronators are supplied by the median nerve. Okay, ये आपको याद रखना है, very important. Now the median nerve के किस किस को सप्लाई करती है, we have already discussed. Now for the median nerve, abductor pollicis longus को टेस्ट करने के लिए यू हैव दी कौन सा पेन टेस्ट. ओके, दिस इज योर पेन टेस्ट. abductor pollicis brevis को टेस्ट करने के लिए abduction, दिस इज योर पेन टेस्ट. एंड flexor carpi radialis को टेस्ट करने के लिए when you will forcibly flex, then the wrist will deviate in the ulnar side. Okay, the wrist will deviate in the ulnar side if there is weakness. It is flexor carpi radialis muscle के लिए. For the flexor pollicis longus, against resistance, you ask the patient to flex the thumb, and this is the pointing index or the Ochsner's clasping test. जब clasp करने को बोलोगे, then this finger will not be able to flex due to median nerve palsy. We have discussed this. Now in median nerve palsy दो और चीजें होती है. First is your ape thumb, क्योंकि ape thumb होता है, this is your ape thumb. Okay, due to thenar muscle. Okay, so sorry, I have told you wrong earlier कि radial nerve thenar muscles को supply करती है. No, thenar muscles are supplied by the median nerve. And this is your benediction hand. अब benediction hand and claw hand में फर्क समझना पड़ेगा. benediction hand is due to the median nerve palsy, so इसमें index and the middle fingers will be unable to flex, whereas if the little and the ring finger are unable to flex, it is the claw hand due to isolated ulnar nerve palsy, and benediction hand is due to isolated median nerve palsy. Okay, remember this. Now the ulnar nerve किस किस को सप्लाई करती है अपन को पता चली गया है. नाउ इसमें याद रखना है आपको, डॉर्सल एंड पामर इंट्रोशियाई को भी ये सप्लाई करती है. एंड यू हैव टू रिमेंबर पैड, यानी पामर इंट्रोशियाई विल डू द अडक्शन. Okay, palmar introsci will do the adduction, and to test that test this you have one Igawa test and the card test for the ulnar nerve. Okay, card test same, if you keep the your here, it is your Igawa test, and one is your Froment sign, very important. Generally you can hold a card like this or book like this, but in generally you can, it is normal. Okay, but if your ulnar nerve is paralyzed, then or there is an injury to the ulnar nerve, then you will have to flex this thumb to hold that thing. This is ulnar nerve palsy के अंदर the Froment sign. and flexor carpi radialis का उल्टा होगा flexor carpi ulnaris के टेस्ट में, where if there is degeneration of this muscle, then your wrist will get deviated in at the radial side. Okay, and abductor digiti minimi को टेस्ट करने के लिए you have this test. Okay, now types of claw hand we have की partial claw hand. This partial claw hand is due to, there are two types of claw hand. The partial claw hand, okay, जिसमें you will have only these two fingers associated. This is your isolated ulnar nerve, and complete claw hand like this, this will be your ulnar plus median nerve. Okay, important. Now the winging of scapula due to injury in the long thoracic nerve, also called as the nerve of Bell or long thoracic nerve of Bell, which is C5, 6 and 7. है ना. There will be winging of the scapula or the boxer's punch test because this muscle supply to the serratus anterior. Okay, this muscle supplies the serratus anterior. Now brachial plexus injury में और the deltoid paralysis में you or the axillary nerve में you have this aeroplane splint. This is your radial nerve palsy, cock-up splint. Okay, this is your ulnar nerve palsy के लिए for the lumbricals, the knuckle bender splint. Okay, now what is this equinus? Okay, क्या होता है in CTEV? Club foot is any deformity of the foot and most common deformity is your equinovalgus. So इसको you called as CTEV, congenital talipes equinovarus. Sorry, most common is your equinovarus, and second most common is your calcaneovalgus. ठीक है, वेलगस एल यानी लेटरल एंड कैल्केनियम यो यानी इक्वाइनस में ऐसे टोज पे चलता है एंड कैल्केनियो में ऑन द हील. एंड हियर यू कैन सी द अडक्शन, द वेरस डिफॉर्मिटी. Okay, and here you can see the cavus में what you have, cavus में the medial the longitudinal arch of the foot is exaggerated, so there will be a deep crease on the palmar aspect. And if there is loss of transverse arch, then you will have this condition called as the splay. Okay, इस condition को क्या बोलते हैं? This condition is called as the splay. यस, सो दीज आर दी वेरियस कंडीशंस इसके बेसिस पे जो अपन ने देखी है. ओके, वेरस, वेलगस, कैवस, इक्वाइनस, दी कैल्केनियस. ओके, दीज आर दी कंडीशंस. नाउ इन CTEV what are the clinical features? सबसे first is your heel will be small but they will be chubby and high, deep creases on the medial aspects, and calf muscles will be thin, and on the lateral aspect there will be dimpling of the skin, shortening of the medial side of the sole, and in chronic cases या बच्चे को चलाना शुरू कर दिया, then you will have the callosities and the bursas as you can see in the image. Okay, now there are two techniques as you all know, kites and the Ponseti, जिसमें से the most widely used is your Ponseti technique. एंड द पॉन्सेटी टेक्निक में क्या होता है, फर्स्ट वीक ऑफ लाइफ में यू स्टार्ट दी ट्रीटमेंट. वैसे द ट्रीटमेंट स्टार्ट फ्रॉम द डे वन. अगर डे वन पे ही आपको पता चल गया है कि यस CTEV है बच्चे के, देन यू tell the mother to do some things. And what is this thing? You train the mother to manipulate the foot, like कि जब भी she goes for the feed, then for 50 seconds के each session के लिए you will ask the mother and instruct and train her to put the pressure on the talus head. एंड उसको टैलस समझ नहीं आएगा इसमें. वैसे पॉन्सिटी टेक्निक में यू पुश पुट प्रेशर ऑन द टैलस हेड, सो उसको टैलस हेड समझ नहीं आएगा. देन उसको आप सिर्फ बोलते हो कि नॉर्मल एनाटॉमिकल पोजीशन समझा देते हो कि इसमें पकड़ के विद द प्रेशर ऑफ योर the fingers. Okay, so this is your Ponseti technique. First of all, फर्स्ट वीक में स्टार्ट हो जाती है, टैलस पे प्रेशर लगाते हैं, above knee cast is used, and firstly cavus is treated, then your varus or the adduction, then at the last equinus is treated, and this equinus is treated by tenotomy of the tendo Achilles. Okay, tenotomy से. While so in the kites में क्या होता है, the kites में calcaneocuboid is the pressure point, below knee cast is used, and सबसे पहले you treat the varus डिफॉर्मिटी इसके अंदर. ओके, सो बेटर इज पॉन्सेटी टेक्निक. एंड इसके अलावा देयर आर सम सर्जिकल थिंग्स अबाउट द CTBS. सबसे पहले PMSTR, पोस्टीरियर मिडल सॉफ्ट टिश्यू रिलीज, जिसमें टेंडो एक्लीज, टिबियालिस पोस्टीरियर, ओके, tibialis posterior, flexor hallucis longus and the flexor hallucis flexor digitorum longus, no, flexor hallucis longus, tibialis posterior, the tendo achilles and your flexor hallucis brevis. And पीछे की तरफ you will have three ligaments, that is your deltoid ligament or the medial collateral ligament, your spring ligament, okay, and your interosseous ligament also. So very important, PMSTR याद रखना है. and इसके अलावा आपको you if age is between 8 to 11 years यानी इतना neglected है, you go for the west arsectomy or otherwise you go for the triple arthrodesis. Okay, and there is one osteotomy also जो बच्चों में करते हैं, very important, नाम याद रखना, that is your Salter's osteotomy. नो, सॉल्टर्स ऑस्टियोटमी नहीं होता है यहाँ पे, यू गो फॉर दी डुयर्स ऑस्टियोटमी. सो वेर इज सॉल्टर्स ऑस्टियोटमी? सॉल्टर्स ऑस्टियोटमी इज डन इन, ओके, सॉल्टर्स ऑस्टियोटमी इज डन इन कॉन्जेनाइटल डिसलोकेशन ऑफ द हिप. नाउ ये आ गया अपन कॉन्जेनाइटल डिसलोकेशन ऑफ द हिप में. मोस्टली इट इज इन द गर्ल्स ड्यू टू द रिलैक्सिन हार्मोन, द फर्स्ट बॉर्न, लेफ्ट साइड and in breech position. इंडिया में कम होता है बिकॉज अबडक्शन करके गोदी में रखते हैं बच्चों को. सो अबडक्शन इज द सेफ पोजीशन. एंड इसमें यू हैव दीज clinical features. सबसे पहले there will be shallow acetabulum and there will be fibrofatty tissue filled in. This is called as, very important, inverted limbus. Okay, this is called as inverted limbus. Capsule will be stretched, the head will be dislocated upwards laterally and the neck will be anteverted. Okay, ligamentum teres will be hypertrophied. Okay, so very important about the congenital dislocation of the hip. And इसमें you have to remember that 2 years तक close reduction followed by maintenance, but you can try it unilateral में for till 10 years, bilateral में till 8 years. then उसके बाद close reduction can fail. So if that fails, you have to go for the open reduction. Okay, you have to go for the open reduction. and इसके लिए you do the following test and these tests are very important. and क्या होता है? first is your Barlow's test and Ortolani test. Barlow's test, B से bad, यानी this is a bad test जिसमें you dislocate the head in the first step and second step because पीछे posteriorly and पीछे आप force लगाओगे like this. Okay, and in Ortolani is a good test because इसमें आप relocate करते हो anteriorly pressure लगा के. so this is your Ortolani test. One is your Galeazzi test जिसमें you compare the height of the knee. and fourth one is your Trendelenburg test and also telescopy test भी आप use कर सकते हो. so telescopy test में ऐसे करके you feel the femur head. and Trendelenburg test, very very important, remember, if this is your affected side तो pelvis इस साइड का झुकेगा, ट्रंक और ऐसे समझो बॉडी विल लर्ज ऑन दिस साइड, the injury will be on this side, so the muscle will be weakened of this side and most commonly the gluteus and उसमें भी most commonly the gluteus medius. very important, this is your Trendelenburg sign, important है examination point of view से. and in maintenance of this congenital dislocation of hip, if you have a frog or Lawrence cast, एंड 6 वीक्स तक अगर ये सही रहता है, देन you go for the bachelor's caste, you can go for the bachelor's caste also. Okay, and ये जो स्पाइका होता है इन लॉरेंस कास्ट जैसा 60 डिग्रीज फ्लेक्शन में, 40 डिग्रीज abduction में एंड 20 डिग्रीज इंटरनल रोटेशन में लगाते हैं. वॉन रोजेनस्प्लिन फोटो देख लो, वेरी इंपॉर्टेंट फॉर योर congenital dislocation of the hip. Okay, this is Springle's shoulder. Springle's shoulder is a congenital condition in which you have a congenital ऊपर की तरफ, that is the scapula is elevated. Okay, elevated, and also there is medial rotation of scapula. Okay, there is medial rotation of scapula here. This is your, this condition is due to radius ही पूरी अगर absent है तो हाथ will tilt towards the lateral side. Okay, so this is called as radial club. This is called as radial club. Okay, this is called as radial club, very important. Now this is your mid lung deformity. इसमें क्या होता है, the mid lung deformity में there is deformity at the epiphysis of the distal end of the radius with dislocation of the ulnar head. This is your mid lungs deformity. Okay, now this is your syndactyly. Syndactyly can be simple अगर fingers जो है उनमें सिर्फ soft tissue common है. If the bones are also fused, then it is complex, and complicated में bones के साथ में you have abnormal tendons and ligaments common, that is syndactyly. Okay, very important. Now this is your congenital vertical talus called as the rocker bottom feet. Okay, called as the rocker bottom feet. Okay, now arthritis can be osteoarthritis जिसमें से primary is the most common, and ये progressive natural disease होती है, बस secondary is due to any previous infection or any trauma or any fracture of the secondary at that joint. So ये pre bony condition की वजह से होती है. So obviously they will be at a younger age. Inflammatory osteoarthritis, there will, where there are cytokines associated with this, they can be rheumatoid arthritis, psoriatic arthritis, or the crystal induced gout and the pseudo gout. And the third one is your septic arthritis, जो नाम से ही पता चल रहा है, there will be इन्फेक्शन. नाउ सबसे पहले पैनस फॉर्मेशन, ये जो होता है, दिस इज योर पैनस. एंड व्हाट इज पैनस? पैनस इज अ हाइपरट्रोफिड साइनोवियम which later get hypertrophied so much that is formed another tissue which is called as pannus, and this disrupts the entire joint, and this is a characteristic of rheumatoid arthritis. This is the characteristic of rheumatoid arthritis, whereas in osteoarthritis, the infected thing will be, in osteoarthritis, the first affected thing will be your cartilage. Okay, it will be your cartilage, whereas synovium अगर है तो it will be your rheumatoid arthritis. This basic difference आपको पता होना चाहिए. Okay, very important. So rheumatoid arthritis, as you all know, is rheumatoid autoimmune. Okay, autoimmune disease होती है, and it is your systemic disease. Okay, rheumatoid factor जो होता है, that is IgM antibodies against FC segment of IgG. ओके, दिस इज योर rheumatoid फैक्टर जो अपन ब्लड टेस्ट करते हैं उसके अंदर होता है. दिस इज योर rheumatoid फैक्टर. नाउ rheumatoid फैक्टर आर्थराइटिस में रिमेंबर मोस्ट कॉमन जॉइंट एसोसिएटेड इज योर मेटाकार्पोफेरेंजियल जॉइंट. Okay, DIP is never affected. Remember, DIP is never affected. Okay, so rheumatoid जो होता है, rheumatoid की late stages में you have the Bottomless deformity of the thumb, ulnar deviation, Bottomless deformity at the thumb, swan neck deformity at the fingers, and the ulnar deviation at the metacarpophalangeal joint, like this image yaad rakh lo. And in toes you will have the hallux valgus, where the first metatarsophalangeal joint जो होगा valgus यानी lateral direction में deform हो जाएगा, and साथ में the image जैसे DIP अगर it is PIP hemato, if both cloto and only DIP, the malate toe. Okay, these are your rheumatoid or rheumatic nodules which are seen in severe cases of rheumatic arthritis, and most common site is your olecranon. Okay, here you can see osteoarthritis में cartilage effect होता है, whereas here it is the pannus, the synovial membrane. And in osteoarthritis you will have the fusiform swellings of the joint, and at the PIP and at the DIP. Okay, at the DIP you will have the Heberden nodes, and at the PIP you will have the Bouchard's nodes, very important. And you'll have this very important thing, that is your metacarpophalangeal joint is not involved, and the distal phalanx will be in radial deviation. ये याद रखना है. MCP is not involved, DIP is involved, and generally the osteoarthritis will firstly affect the large joints, mainly the knee joint. अब osteoarthritis and rheumatoid arthritis में differentiation is very important. So rheumatoid arthritis at any age, osteoarthritis only later. Speed of onset इसकी ज़्यादा होती है. Distribution we have discussed, but remember this will be polyarthritis and symmetrical, also bilateral, and ऐसा इसमें कुछ भी नहीं होगा. Joints affected will discuss the duration of morning stiffness. It will be worse more than 1 hour in rheumatoid arthritis, less in osteoarthritis, and rheumatoid will be associated with systemic symptoms also. Okay, very important. Now we'll comes to the ये गैंसल साइन. वो गैंसल साइन से आपको एक चीज याद आनी चाहिए, and that चीज is your ankylosing spondylitis. And ankylosing spondylitis आते ही आपको याद आना चाहिए HLA-B27 and your bamboo spine. HLA-B27 and your bamboo spine. Okay, so there is ankylosing, yani ki the joint will not be maintained, and there will be ankylosing of the joint, so there will be no movement. First and the most common joint associated is the sacroiliac joint, and उसको टेस्ट करने के लिए you have the Gansel test and the pump handle test. Okay, so Gansel test is this. Okay, जो affect testing side होती है, that is outside of the table, that is your Gansel test. Okay, and this is your Flaque test. If it is involved the cervical spine, you will not be able to touch your occiput to the wall if you are standing straight. Okay, now this is your SLR, that is the straight leg raising test, done for this condition as well as to check the neurological condition. इसमें आपको ध्यान रखना है, अगर 30 to 70 degrees के बीच में पेन है, then that is neurological pain. Very important, आपको ध्यान रखना है. नाउ गाउट वर्सेस सूडो गाउट में बेसिक डिफरेंस जो है वो है कि इन गाउट योर there will be no calcium salts, whereas in pseudo gouts there will be calcium salt. Okay, for the crystal will be needle shaped, the rhomboid shape, with positive birefringent. That means it is pseudo gout. Most commonly associated the great toe, and most commonly associated is your knee. Okay, very important, the differentiation between gouts and the pseudo gouts. Okay, now what is this? This is your Charcot joint, which is the neuropathic joint भी बोलते हैं, and there will be painless effusion and painless arthritis. This is your Charcot or the neuropathic joint. Very important, नाम से पता होना चाहिए पिक्चर देख के. Now what is this? This is your simple osteoma, which is a benign, no pre-malignant potential, and mostly in the craniofacial bones. This is your osteoma. Okay, now what is this? This is your osteoid osteoma, which is also benign, no pre-malignant potential. Most commonly distal femur या proximal tibia के metaphysis वाले area में होगा. Okay, now what is this? This is your multinucleated giant cells or GCT, misnomer osteoclastoma, because osteoclastoma clast का होता नहीं, so this is misnomer है ना. After fusion of epiphysis होगा, most commonly in the proximal tibia and the distal femur. Okay, in 10 to 20 years of the age में there will be soap bubble appearance. Okay, there will be soap bubble appearance, and its treatment depends on its location. Okay, agar treatment, you can go for the curettage followed by the bone cement due to thermal effect. Only excision in ulna or the fibula, and excision followed by the grafting. There's a turnoplasty, excision followed by the turnoplasty arthrodesis. That is for the tibia and the radius. Okay, remember this. Now we'll come to the osteogenic sarcoma or the osteosarcoma. It is basically of two types, the primary and the secondary. Primary more common होता है. There is no bony pre-malignant condition associated. It is generally in the young adults and more poor prognosis, more cancerous. Secondary in the elderly. Pre-malignant conditions associated like enchondromas or dysplasia, etc. Okay, very important. Osteosarcoma most commonly seen in the distal femur and proximal tibia in the metaphyseal region, and एक्सरे में you will have बहुत ज़्यादा periosteal reaction, very intense, irregular in the soft tissue leading to the sun ray appearance. Okay, and there will be pleomorphic cells which are with nuclear atypia. Okay, it can be of various type like fibroblastic type, the cartilaginous type, but most worst prognosis वाला जो होता है, that is your osteolytic type or the telangiectatic type. Now grossly they will be hard, gray white with gritty feeling when you will cut them, and they are generally बहुत बड़े when they are diagnosed. So the treatment is the amputation, but nowadays limb saving surgery is used, where you go for the wide excision with the curettage and wide now this is your Ewing sarcoma. Very rare tumor but very malignant tumor, most commonly in the pelvis region, and अगर long bone में होता है तो it is in the diaphysis. Okay, very important. Young adults में होगा, and histologically there will be uniform cells like lymphocytes, and beach में there will be area of necrosis surrounding, and they will form a pseudo rosette. Okay, they will form pseudo rosette, और यहाँ पे ध्यान रखना they are very highly radio sensitive. Okay, they are highly radio sensitive. They are highly radio sensitive. Okay, this is picture of chondrosarcoma. Okay, this is a picture of chondrosarcoma. Now we'll come to the pelvis injuries. Okay, now अपन किस पे आ रहे हैं? Now we are coming to the pelvis injuries. So याद रखना pelvis injuries में Marvin-Tile classification is very important, and in Marvin-Tile classification A, B and C, A is stable, these two are unstable. They are isolated fractures, most commonly the fracture of the superior pubic rami or the inferior pubic rami. B में there is only rotational instability, and most common is your pubic or the pelvic diastasis. Okay, or the open book injury. Okay, pubic symphysis दूर हो जाता है, the open book injury. Okay, and the C is vertical instability plus rotational instability. Vertical is more important. Okay, so इसके साथ में the acetabulum fracture, the iliac blade fracture सब कुछ associated होंगे. Okay, and for your pelvic diastasis एक hemlock sling like this, or you can use the external fixation or the internal fixation for the pelvic diastasis or the open book or type of injury. Femur head का blood supply is very important. Okay, it is from three different sources. First is your medial side, say you will have the medial side, say you will have the medial circumflex artery, and from the lateral side the retinacular arteries, and third is your foveolar arteries or the arteries to the ligamentum teres. इनमें से 1 and 2 are the major suppliers, and these two are damaged in case of fracture neck of femur. That's why avascular necrosis के chances बहुत ज़्यादा होते हैं. Now this is hip dislocation, and what is this? यहाँ पे the femur head is posteriorly dislocated, so this is posterior dislocation of the hip, most common. And here you can see the dashboard injury की वजह से होगा, क्योंकि ऐसे the force होगा, so the hip will be, here you can see in the diagram, the adducted internal rotation and flexion. Like any other dislocation, you go for the close reduction, and there are two techniques for the close reduction. One is the Bigelow's method, and the second is the Watson and Jones method. Very important. This is your skin traction. Okay, now neck of femur. So याद रखना neck of femur and IT femur में differentiation is very important. नेक ऑफ फीमर दोनों ही एल्डरली में ही होता है, ये ध्यान रखना. इट इज इंट्रा कैप्सुलर, इट इज एक्स्ट्रा कैप्सुलर. सो इंट्रा कैप्सुलर है तो कैप्सूल के अंदर, तो ऑब्वियसली द डिस्प्लेसमेंट विल बी लेस, द डिस्प्लेसमेंट विल बी ज्यादा. हियर द साइंस एंड सिम्टम्स विल बी लेस, दे आर ज्यादा. यूनियन is rare. Yeah, there are less chances of union and high chances of avian, whereas they always unite. Okay, they will always unite. Okay, neck of femur always surgical, except if it is impacted, that we'll see. Okay, and they can be conservatively managed. Okay, they can be conservatively managed. This is your IT femur. Okay, now neck of femur के three classifications है. First is your anatomical classification, site of the fracture line, the subcapital, transcervical or the basicervical. And second is Powell's angle के basis पे, at the superior border of the femur head to the fracture line. This is your Powell's angle or the Powell's classification. जैसे जैसे बढ़ता जाता है टाइप 1, 2 and 3 हो जाता है, very important. And the more the angle, the worse is the prognosis. And the third is your Gardner's classification, which is based on its rotational displacement. First, it is incomplete, called as the impacted or the abducted neck of femur. Second, complete होगा but no displacement. Here displacement होगा लेकिन कम होगा, displacement होगा लेकिन ज़्यादा होगा. Okay, this is your Gardner's classification for fracture neck of femur. Okay, what is this? This is your fracture or traction table used in OT, and this is your image intensifier IITV or the CR machine, portable X-ray machines, routinely used in our operation theaters. और neck of femur का अगर treatment आपसे पूछे, so in adults the treatment of choice will be your CC screw, corticocancellous screw or a dynamic hip screw, or in the elderly you will have to go for the hemiarthroplasty. टोटल से डिफरेंट कैसे है ये, इसमें एसिटाबुलम इज नॉट चेंज्ड एंड इट इज ऑफ टू टाइप्स, यूनिपोलर एक ही पोल में मूवमेंट होगा एंड बाइपोलर दो पोल्स में दो साइड में मूवमेंट होगा, एंड बाइपोलर इज मोस्ट कॉमनली यूज्ड. हियर यू कैन सी सिर्फ एक ही, यहाँ पे दो है, इस प्लेन में भी मूवमेंट होगा, इस प्लेन में भी मूवमेंट होगा, इसमें सिर्फ इसी प्लेन में मूवमेंट होगा. सो दिस इज योर बाइपोलर. ओके, एंड यहाँ पे एसिटाबुलम भी चेंज कर दिया है. सो दिस इज योर टोटल आर्थ्रोप्लास्टी. हैमिल्टन रसल ट्रैक्शन पुराने जमाने में यूज करते थे नेक ऑफ फीमर फ्रैक्चर के लिए. नाम और इमेज याद रखनी है. Normally, the neck shaft angle is 120 degrees around in adults and 160 degree around in infants और बच्चों में. So अगर ये angle जो है, this angle is decreased, then it is called as coxa vara, and generally it is present in congenital displacement of the hip. This is your skin traction and this is your skeletal traction, where a ST pin or the Steinman pin is used, like in this case in the proximal tibia, to give the traction. This is your hip spica, used for fracture shaft of femur and other types of fracture के लिए, conservative management के लिए. This is your hip spica. This is your gallows traction, जहाँ पे your hip should be ऊपर और superior to the bed. Gallows traction less than 2 years of age के बच्चों में फ्रैक्चर शाफ्ट ऑफ फीमर को कंजर्वेटिव ट्रीट करने का लिए यू यूज दिस ट्रैक्शन विच इज कॉल्ड एज द गैलोज ट्रैक्शन. ओके, नाउ नी के anatomy में you know the extensor mechanism very important and very easy. By the quadriceps femoris muscle, femur, quadriceps femoris, patella, then patellar tendon, then to the tibia, and यहाँ साइड में you have the patellar retinaculum. Okay, so patella fracture, patella dislocation में this mechanism is injured. फ्रैक्चर पटेला जो होता है, इट कैन हैपन इन एनी टाइप. अगर आपके अनडिस्प्लेस्ड है तो यू कैन गो फॉर द कंजर्वेटिव विद द सिलेंड्रिकल कास्ट. अनडिस्प्लेस्ड सिलेंड्रिकल कास्ट, नाम सिलेंड्रिकल कास्ट ये इसके लिए इम्पोर्टेंट है. डिस्प्लेस्ड है तो the surgery is TBW, tension band wiring, or you can go for the partial or complete patelectomy. And ये ध्यान रखना है, patelectomy करो ये करो, you have to repair the injured or the torn retinaculum वेरी इंपॉर्टेंट। ओके, पटेला को अच्छे से देखने के लिए यू हैव दिस व्यू दैट इज कॉल्ड एज द स्काईलाइन व्यू। ओके, एंड टिबियल प्लेट्यू के फ्रैक्चर्स जो होते हैं, तो दे आर फ्रैक्चर ऑफ टिबियल प्लेट्यू। एंड इसके लिए आपको सिर्फ एक चीज याद रखनी है कि यू गो हैव ए क्लासिफिकेशन कॉल्ड एज कैट्सगर टाइप्स। Okay, it is Katzger types. Okay, now पटेला के डिसलोकेशन में और पटेला के साथ यू हैव ए इंसल सलवती रेशो, जिसमें पटेला की हाइट डिटरमाइन करते हैं बिटवीन पटेला लेंथ एंड पटेला टेंडन की लेंथ एंड पटेला की लेंथ का रेशो होता है, नॉर्मली 1 होता है। अगर ज़्यादा होता है यानी ये हाई लाइंग पटेला होता है टुवर्ड्स द फीमर, कॉल्ड एज द पटेला ऑल्टा, एंड इसका उल्टा इज पटेला बाजा। And patella alta is associated with the habitual or recurrent dislocation of the patella, वेरी इंपॉर्टेंट। और जो रिकरेंट हैबिचुअल इज जब जब आप फ्लेक्स करो, एवरी टाइम यू फ्लेक्स यू हैव द डिसलोकेशन, एंड इसमें यू हैव टू रिकंस्ट्रक्ट द मीडियल पटेलो फेमोरल लिगामेंट, एंड इस ऑपरेशन की एक नाम होता है दैट इज कॉल्ड एज हाउजर्स ऑपरेशन। नाम याद रखना है आप। ओके, व्हाट इज दिस? दिस इज एन एक्सटर्नल फिक्सेटर ऑन द टिबिया। टिबिया जो होती है इज अ सबक्यूटेनियस बोन, सो देर आर हाई चांसेस ऑफ ओपन इन फ्रैक्चर, एंड ऑल्सो इसका जो डिस्टल 1/3 होता है वहाँ पे द ब्लड सप्लाई इज वेरी लेस, सो दैट्स वाई नॉन यूनियन के चांसेस बहुत ज़्यादा होता है एंड इन्फेक्शन के चांसेस भी बहुत ज़्यादा होते हैं। ओके, नाउ टिबियल फ्रैक्चर्स में स्पेशली कंपाउंड या नॉन यूनियन फ्रैक्चर्स में यू गो फॉर द फेमिस्टर ग्राफ्ट। तो ये ध्यान रखना, कहीं पे भी फेमिस्टर ग्राफ्ट नाम आ जाए तो दैट मीन्स इट इज योर टिबियल फ्रैक्चर। फ्रैक्चर टेलस, so neck of the talus has an precarious blood supply and mostly fracture यहाँ पे होता है, so there are high chances of avian, and mostly it occurs in airplane crash called as aviators fracture, and also mostly fracture talus जो होता है, the fracture talus is associated with एक्सटर्न व्हेन एंकल इंजरी कैसे होती है, एक्सटर्नल रोटेशन एंड प्रोनेशन के अंदर। ओके, नाउ वेरियस लिगामेंट्स ऑफ द नी। सो क्रूशिएट लिगामेंट क्रॉस के शेप में होता है, एंटीरियर वाला एंटीरियरली किससे, टिबियल स्पाइन से, एंड पोस्टीरियरली फीमर से, एंड इसका उल्टा पोस्टीरियर वाला। साइड में यू हैव कोलेटरल लिगामेंट्स, एंड गद्दे होते हैं, मेनिस्का इज गद्दे। ओके, नाउ इनके फंक्शंस जो होते हैं, मेनिस्का आर द शॉक एब्जॉर्बर्स मेनली रोटेशनल के लिए, दी कोलेटरल आर आल्सो फॉर द रोटेशनल एंड दी मीडियल और द लेटरल डिस्प्लेसमेंट को प्रिवेंट करते हैं, एंड दी क्रूशिएट लिगामेंट रेस्पेक्टिवली एंटीरियर एंड पोस्टीरियर डिस्प्लेसमेंट को प्रिवेंट करते हैं। मेनिस्का इंजरीज इन मोस्ट कॉमन इज योर bucket handle injury of the menisci, and in all most common injured is your ACL. Okay, and ACL, medial collateral ligament and मीडियल मेनिस्का साथ में ही इंजर्ड होते हैं जनरली, एंड ये दोनों आपस में कनेक्टेड भी होते हैं, एंड द सर्जरी दैट इज यूज्ड इज योर आर्थ्रोस्कोपी, वेरी इंपॉर्टेंट बट नॉट urgently, at least after 2 to 3 weeks, जब सारा hematoma and the inflammation subside हो जाता है। यहाँ पे भी you have the bursa, that is your synovial fluid filled sac, सुप्रा पटेला पटेला के ऊपर, इंफ्रा पटेला पटेला के नीचे, प्री पटेलर पटेला के सुपीरियर यानी स्किन और पटेला के बीच में। एंड इंफ्रा पटेलर भी दो टाइप का होता है, सुपरफिशियल स्किन एंड पटेला टेंडन के बीच में, एंड पटेला टेंडन और पटेला के बीच में इज योर डीप। ओके, एंड पेस एंसिरिनस और द सेमी मेम्ब्रेनस बर्सा। ओके, अब यहाँ पे यू हैव टू कंडीशंस. फर्स्ट इज योर हाउसमेट्स नी, एंड इस हाउसमेट्स नी में यू हैव द प्री पटेलर बर्सा bursitis. Okay, and the clergyman knee भी होता है, and in that clergyman's knee you have the infrapatellar bursitis. You have the infrapatellar bursitis. Okay, now for the anterior cruciate ligament you have the anterior drawer test like this, and also your Lachman test. स्ट्रेस टेस्ट तो आप किसी में भी कर सकते हो. जो मैंने बताया था वो तीनों चीजें MCL, MM एंड ACL टर्न हो जाती है. दिस इज कॉल्ड एज द अनहैप्पी और टेरिबल ट्रायड ऑफ द नी और द ओ डोनेगी ट्रायड. जनरली इट हैपेंस इन द रग्बी या वायलेंट स्पोर्ट्स जो खेलते हैं उनके अंदर होता है. This is your stress test, this is your Lachman test, this is your posterior drawer test for the PCL. And what is terrible triad of elbow? Terrible triad of elbow, three things होती है. Firstly dislocation, mostly posterior, fracture of head of the radius, and fracture of coronoid process of ulna. Okay, now this is your your knee brace or the knee immobilizer used in ligament injuries of the knee. Okay, this is your McMurray's test. This is your McMurray's test used for menisci. और एक मैकमरेज ऑस्टियोटमी भी होती है. ठीक है, फ्रेंच ऑस्टियोटमी सुप्राकॉन्डाइलर ह्यूमरस के अंदर क्यूबिटस वेरस. योर सॉल्टर ऑस्टियोटमी इन दी Salter's osteotomy in the congenital dislocation of the hip. Duer's osteotomy in the CTEB, and McMurray's osteotomy is done in McMurray's osteotomy भी होती है एक में, and it is done in fracture neck of femur. पहले करते थे, अब नहीं करते हैं. Okay, now Epley's grinding test like this, it is also for the menisci के testing के लिए ना. ऐसे होता है, याद रखना है. देन एक इम्पॉर्टेंट चीज है, मोस्ट कॉमन एंकल स्प्रेन या एंकल इंजरी जो होती है, इट इज ड्यू टू इन्वर्जन. एंड अगर इन्वर्जन होगा सो मोस्ट कॉमनली द इंजर्ड पार्ट इज योर लेटरल कोलेटरल लिगामेंट. ये याद रखना है. एंड मैकेनिज्म ऑफ इंजरी के बेसिस में द एंकल बोनी इंजरीज आर क्लासिफाइड इनटू डिफरेंट टाइप्स, एंड इसको बोलते हैं लॉग हैंसन क्लासिफिकेशन. ओके, इट इज कॉल्ड एज लॉग हैंसन क्लासिफिकेशन. नाउ वेरी इंपॉर्टेंट, दिस इज योर लिस्फ्रैंक फ्रैक्चर which is injury or dislocation between second metatarsal base and medial cuneiform, और इन दोनों के बीच में there is one ligament called as the Lisfranc ligament, जो यहाँ के आसपास की joints की stability की होता है के लिए होता है. इस डायरेक्शन में if there is trauma or the force is applied like this, there is dislocation and Lisfranc injury. This is torn here. Okay, and the treatment of choice is your surgery. That makes it very special. The treatment of choice is your surgery. Okay, now thighs में तीन compartments होते हैं, leg में ये होते हैं the nerves, so we leave it for the anatomy वाला part. Okay, do it there. दिस ना ये अपन अभी कवर नहीं करेंगे. ये दिस फिकेट क्लासिफिकेशन और दी फिकेट आर्लेट क्लासिफिकेशन नाम से याद होना है. इट इज फॉर द एवियन एवेस्कुलर नेक्रोसिस ऑफ द हिप जॉइंट. ओके, एंड 2 इज द प्री कोलैप्स पार्ट जहाँ पे सिस दिखेंगे. 3 में यू विल हैव द कोलैप्स एंड वेरी इंपॉर्टेंट द क्रिसेंट साइन. एंड D में द आर्थराइटिस will occur in the D part, very important. Okay, and एक और classification है that is used for avian, it is called as the Steenberg classification. Okay, this is called as the Steenberg classification. ये भी आपके avian के लिए होता है. This is your sciatic nerve palsy या other causes like CVA, okay, or the common peroneal nerve injury, etc. इनमें you have the foot drop, and this is your foot drop splint. Okay, what are the radiological features? Sequential, crescent sign, osteoporosis, sclerosis, subchondral cyst तो सबसे पहले हो जाएगा. Then collapse and the secondary osteoarthritis. Scaphoid fracture, very important. Most common carpal fracture is your scaphoid fracture, and इसके लिए you have to do a अलग से view to view this fracture, that is your oblique view. Sorry, so this is your oblique view. एक अलग से फ्रैक्चर सॉरी एक अलग से एक्सरे व्यू हैव टू डू. अब स्केफॉइड फ्रैक्चर जो होता है एनाटॉमिकल स्नफ बॉक्स में होता है, एंड देयर आर हाई चांसेस ऑफ एवियन, जिसकी वजह से यूनिक हो जाता है. इसके 3 पार्ट्स हो जाते हैं, प्रॉक्सिमल, मिडिल एंड द डिस्टल 1/3. इट इज कॉल्ड पोल, इट इज कॉल्ड एज ट्यूबरकल, एंड इन दोनों का जंक्शन और द मिडिल 1/3 is called the waist. Most common site of fracture is your waist. Most common site of avian is your pole. And इसमें you have an अलग से that is cast, that is called a scaphoid cast, और glass holding form में you put it, so it is called as glass holding cast. अब इसमें भी palmar deviation होता है, ulnar palmar deviation होता, palmar flexion होता है, sorry, like in the Cooley's cast, but Cooley's में there was ulnar deviation. Here you will have the radial deviation, plus thumb will also be covered in the cast. So this is your scaphoid cast. Okay, now what is this? This is your Mafushi syndrome. In Mafushi syndrome, it is a congenital syndrome or hereditary disorder where there will be multiple enchondromas and cavernous hemangiomas like this. But this is your Olier's disease. Olier's disease की खास बात ये होती है, सबसे पहले it is non hereditary. एंड क्या होता है, जो एपिफाइजल प्लेट होती है वहां पे कुछ पार्ट ऑफ कार्टिलेज रह जाता है, परसिस्ट, विच इज नॉट ऑसिफाइड, एंड इट then persist within the metaphysis of the long bones. So there will be such deformities called as the Olier's disease. Now splints जो होते हैं वो 3 types के होते हैं. First is your cast which encircles completely. Slab जो सिर्फ एक साइड में होते हैं और completely हो गया तो cast. and spica where एक जैसे हिप स्पाइका अपन ने देखा, द ट्रंक का पार्ट जो होता है वो भी होता है. शोल्डर स्पाइका में ये वाला पार्ट. सो दिस इज योर स्पाइका. नाउ वी हैव डिस्कस, दिस इज योर स्किन ट्रैक्शन. Okay, and this is your cervical traction for cervical injuries, and skeletal traction we have already discussed. अब ये important 90-90 traction जो होता है young children के अंदर, you do it for the ST subtrochanteric femur और the proximal 1/3 femur के treatment के लिए you go for the 90-90 traction. Distal femoral traction is like this. For the proximal femur fracture, distal femur पिन डाल के वहां से ट्रैक्शन देते हो when the fracture is in the proximal femur or the acetabulum. Okay, and head halter classification, head halter traction is for the cervical injuries. Okay, sliding traction when the काउंटर वेट जो होता है ये बचा हुआ पूरी बॉडी जो होती है वो काउंटर ट्रैक्शन देती है. एंड बक्स ट्रैक्शन इज लाइक दिस, इट इज पुट लाइक दिस where you use a tape or a pre-made boot, and it is for the fracture of neck, femur or shaft, etc. और मेंटेनेंस ऑफ द रिड्यूस्ड हिप। हैमिल्टन रसल अपन ने पहले ही देख लिया, फ्रैक्चर नेक ऑफ फीमर में काम में लेंगे। Dunlop's traction very important. It is used for the fracture of supracondylar और condyle region में जो होता है ह्यूमरस के, उसके फ्रैक्चर में you use the Dunlop traction. See the image, remember this. And this is your cast. अब cast दो टाइप का होता है आर्म के अंदर, शॉर्ट आर्म called as the below elbow and long called as the above elbow. ठीक है, और इसी में अगर सिलेंड्रिकल हो जाएगा, सो ये दोनों तो होते हैं मेटाकार्पल के हेड तक। अगर ये सिर्फ रिस्ट तक ही होगा, सो इट इज कॉल्ड सिलेंड्रिकल कास्ट, जो एल्बो इंजरीज में यूज होता है। इसके काउंटर पार्ट नीचे होंगे, बिलो नी, अबव नी एंड योर सिलेंड्रिकल, जो किस में यूज होता है, जो सिर्फ एंकल तक ही होता है, अबव एंकल होता है, एंड इट इज यूज इन केस ऑफ पटेला। ओके, वेरी इंपॉर्टेंट। नाउ ये अपन ने कर ही लिया सारा डिस्कस। एक इसमें इंपॉर्टेंट इज मिनर्वा कास्ट विच इज put around the neck and the trunk of the body, and it is generally injury इस area में upper back में और after the neck surgery. Scaphoid cast we have discussed. Okay, now these are different types of casts which are important. ये आप याद रख लो, बस खत्म होने वाला है. Okay, only 2 to 3 slides are left. Okay. सो बॉक्सर्स फ्रैक्चर, जैसे फिफ्थ मेटाकार्पल की नेक का फ्रैक्चर होता है, सो बॉक्सर्स फ्रैक्चर में ऐसे अल्नर गटर कास्ट इज यूज्ड। वोलर कास्ट जो होता है, हियर यू कैन सी द वोलर कास्ट, जो वोलर साइड में आप ऐसे लगाते हो, वोलर साइड यानी एंटीरियर साइड में, डन फॉर द रिस्ट स्प्रेन्स और द कार्पल टनल सिंड्रोम, वेरी इंपॉर्टेंट। थम स्पाइका, जिसमें थम को यू कवर, this is done for the Bennett's fracture, intraarticular fracture of the thumb at the this carpometacarpal side पे, the Bennett's fracture or the scaphoid fracture. Reverse sugar tongue is used in the Colles fracture. Okay, ankle stirrup, ankle injuries में like this, and posterior ankle cast टिबिया फिबुला में, एंड नी मोबिलाइजर अपन ने देख लिया था। तो दिस इज योर अल्नर गटल स्प्लिंट फॉर द बॉक्सर्स फ्रैक्चर। ओके, दिस इज योर थंब, है ना। शुगर टोंग इज लाइक दिस। ओके, इमेज को आप याद रख लो, ये सब पढ़ोगे कंफ्यूज हो जाओगे, सिर्फ इमेज को याद रख लो। ये याद रखो, डिस्टल एंड रेडियस अल्ना यानी कोली स्मिथ फ्रैक्चर वगैरह में यू यूज इट। दिस इज लाइक द शुगर टोंग स्प्लिंट। ओके, दिस इज योर एंकल स्टिरअप फॉर द एंकल इंजरीज। ओके, सो ये था, जल्दी जल्दी से अपन ने किया है सब। सो अच्छे से एग्जाम देना, ऑल द बेस्ट, और अब सब जने सो जाओ, इट्स हाई टाइम, सुबह 9 बजे से एग्जाम है। सो ऑल द बेस्ट, डू योर बेस्ट एंड डोंट गेट कंफ्यूज और डोंट गेट टेंस्ड अगर क्वेश्चन नहीं आए। सबके पास ऐसे 4-5 सेट आएंगे। बी पॉजिटिव एंड आफ्टर गिविंग टेस्ट जस्ट एंजॉय। ओके, सो ऑल द वेरी वेरी बेस्ट, सब अच्छा होगा। एंड